Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, I have Eran Ofir with me, who is the CEO and co-founder of Somatics. Welcome to the show, Eran.
Hi, Dr. Roxy.
So
Welcome,
for our
everyone.
listeners that don't know you, just give them a little bit about your background and what you do.
So in 2015, I established Somatics. We do remote patient monitoring. We work with hospitals, elderly care facilities, and rehab centers, providing them remote patient monitoring platform. My background is building businesses of enterprise-grade SaaS platforms. I've done it for the last 2 decades in different domains: telecom, internet, utilities, retail, and now healthcare. Because from my perspective, it's basically the same. Building a cloud-based platform for an enterprise, improving their KPIs and making their life easier, basically, through the technology.
Yep. So, so let's talk about pre-COVID. Where were you in the innovation process? And, what was your go-to-market strategy at that point?
Right. So obviously now it's a very different time. While we are in this crisis, I'm in New York, so it's even intensified, everything that is happening around. Mm-hmm. So, pre-COVID, we started the year in an amazing momentum. We had like the best 2 months of the company in terms of sales, implementations, pipeline, everything, because the product came to a stage where it is robust, scalable, mature. It had kind of the needed functionality, and we obtained the clinical validation for it in terms of improvement of clinical metrics with the healthcare providers that we work with, and proving the reimbursement codes. Basically, the entities that we worked with managed to get reimbursed with the CPT codes for remote monitoring. So that was a huge point for us in terms of commercial validation. So everything looks great until the beginning of March. We had like 9 different industry events lined up for March to May. HIMSS, Pedona, Leading Age, Aging in America, everything. So kind of our entire marketing campaign collapsed by mid-March. And so it's very different, obviously, from a situation where the company can hardly cope with the number of installations and with the tasks and with the delivery to a situation where everything is almost standstill, as it is now, kind of waiting for this to end and for us to be able to meet again the healthcare providers, because now they're all our customers are now in lockdown. They're running in emergency situations because, again, we sell to healthcare providers. And we just wait for them to get back to life, kind of.
Mm-hmm. Yeah. So, I think that your experience is something that we're all feeling across the board in varying degrees. So, let's just talk about the financial impact as a health innovator. I think that's going to vary from innovator to innovator depending on where they were in that capital raising process. But, just kind of paint that picture for us.
Right. So it's a very difficult period, I believe, to all startups. We were a little bit lucky because we had in 2019 a bridge round, kind of a convertible loan agreement for the company of $4.5 million. That was on top of what we had before of seed round and A round. In total, we have raised to date $11.5 million. And so we started the crisis in a not so bad situation. But again, we are not, the problem is that you continue the burn rate, the regular burn rate of the company, because you want to prepare the company for the day after, which we believe will be very good. And yet you don't have revenues coming in because everything is shut down, and the procurement departments of your customers are busy in other things, finding vents and medical supplies and bringing back stuff from pension, kind of medical stuff from retirement. So we had to do some actions in order to mitigate that. As many other startups, we had to reduce our burn rate. That included some reduction in force. It included activities like freezing contractors that we work with, everything that we could beyond, like, keeping the core and the software and the servers and everything kind of running and in a keep alive mode. Everything that we could cut. We reduced salaries across the company by 20%. Everyone obviously accepted it because they understand the need for it, versus retiring more employees. So we had to do, we agreed with the board, with our board, as for the actions that we're going to take, and we discussed the various scenarios of what will happen if this will end on June, in August, and so on, because it's different scenarios, and we hope for the best.
Yeah, absolutely. And, I think hope is definitely the right word. As a leader of a company, being able to spread that hope, I think, is really important. And when you can give your staff hope that there's going to be a light at the end of this tunnel and brighter days are ahead, I think that's where, they can recognize that, yesterday, today, and tomorrow, they're going to be making a big difference in the world, right? Through the work that you're doing. And so kind of to stick with it and make the sacrifice that we're all making in some form or fashion. So let's talk about what you're kind of thinking that might look like in a few months. Of course, none of us know when this will happen. And, it sounds like, each state is going to be in a different phased approach at a different time. But, you and I were talking that, there's been varying degrees of adoption of different types of digital tech in healthcare. Right. And so how do you see, this COVID crisis having a silver lining for your company in kind of what you're predicting the adoption might be in the future?
And so this is exactly the hope perspective, because we believe, both the employees, the management, the investors, that the market after the crisis will be very good for us. We expect our business to peak, because everyone now realize, in terms of our customers, hospitals and elderly care facilities and so on, they all realize the importance of remote patient monitoring. They all understand that they need, that in times of urgency, they are short-staffed, and they need technology in order to attend to the needs of patients. They need to be capable to see with AI technologies whether there is a deterioration of a patient or improvement, and to be capable to respond to it, basically, and intervene. But they don't have enough manpower to, go one by one and check them now. It's just not feasible when they're so overwhelmed. We believe that there will be a strong support from the regulation, that the tailwind that we see in terms of reimbursement codes and telehealth and everything will be even bigger with all kinds of incentives from the federal governments and from the states. And the most important, everyone realized now that there will be probably a second wave of COVID-19 next winter.
Mm-hmm.
So they have a window of opportunity of kind of 6 months, probably between the end of this crisis, when business will get back to normal, and until, or to the new normal, let's call it, until they need to get themselves equipped with such technologies. So we expect our market to be crazy after, as business open up, as healthcare providers will be getting out of that emergency scenario that they are now in.
Yeah. It's interesting. I think smart investors see what's happening, and instead of pulling money back, the right thing is pouring more money in, right? Because that day is coming. It's just around the corner.
We see many acquisitions now happening of remote patient monitoring and clinical decision support system. Yesterday, there were two big acquisitions of the UK, and we saw in the last 3 months a few acquisitions like that again, because people understand that home care and remote monitoring and that concept of telehealth is going to prevail strongly. So now, as we speak now, what we talk with PEs and we talk with VCs, so they are kind of sitting on the fence. They are not yet making, big moves. They wait to see. The main question that is being asked, in those daily conversations that we have with them, is when is it going to end? Because it's very different if the business is back to the new normal on June, so you still have half a year to work and return to revenues and expand both horizontally and geo expansion and everything, or the business is going back to work only on September. And then, within 2 months, you're already getting into holidays and year end, and that's it. The year is lost, kind of. So everyone are waiting to see, okay, so what's the government going to do? When are they bringing businesses back to life? So that's, I think, is really the most important question currently in that financing industry.
Yeah, for sure. So, one of the things that I think is really interesting about the work that you guys are doing is you're serving a lot of the populations that are in nursing homes, right? And we're seeing more and more of those conversations about, being hotspots and really what's going to be our mitigation strategy going forward. And I think, like you had mentioned earlier, we'll go back to normal, but it will be a new normal. And so how do you think, what role is technology like yours going to play in the nursing homes going forward around those, social distancing and mitigation strategies to make sure that those, healthcare professionals aren't at risk? And, so just kind of talk about that a little bit.
So we indeed serve elderly care facilities across the care continuum. We have independent living, assisted living, subacute short-term care, and nursing homes. We also serve hospitals for the business case of discharge, remote patient monitoring of discharge patients, as well as rehab centers. But the elderly care facilities are really our low-hanging fruit. Now, even prior to the COVID-19 crisis, what we saw there is that because of regulation, especially two things. One was the availability of remote patient monitoring codes for them from January 2020. So they all started playing with that, which is a new revenue stream for them. That's great. So that was one thing. And the other thing that is also new is what's called community health choices, meaning them being audited like twice a year on their quality metrics, falls, readmissions, pressure ulcers, UTIs, and so on. And they are getting a grade. And with that grade, like if they are 5 stars or 4 stars and so on, two things happen. First, with a higher grade, They are the first to get patients into their subacute short-term care and nursing homes. So their departments are being filled first. And the second thing is that with a higher grade, they get more payment per patient per day in their subacute care and this in the nursing homes. So they all understood even before, it was just starting. That's why we really miss all those events, marketing event, industry events that got canceled. But they all understood at the at the first 2 months, in fact, from Q4 of 2019, that there is a big change here in terms of the financial models that you run your elderly care facility on. And we indeed saw, it's not a coincidence that we saw all the big players like Amazon Care and Apple and Google and Best Buy even buying companies that are doing remote patient monitoring and clinical decision support systems and AI, because they all figured out suddenly, even the corporate, we saw Comcast building Quill, like providing a home care service to their 22 million subscribers at home. And we saw AT&T suddenly opening AT&T Healthcare. So all the corporate America, everyone understood that, again, because of the demographics in the US, because of the number, every day in the US, 10,000 people are getting to be older than 65. Right. So the numbers are obviously there. And elderly care is the fastest growing segment in US healthcare, like for the last 3 years or so. So the trend was obvious, but it wasn't a necessity. And that's the big difference. Like until March, telehealth was nice. It was more relevant to the bigger elderly care facilities, the ones that are more like a network and they have a CIO and IT department in place, and some of them even innovation officer. But the smaller ones didn't need it because they thought, well, some of them, even don't use kind of electronic health records to which we integrate and so on. But now it's completely different. Because now even the smaller ones, in fact, the smaller ones are in a war situation because there are very short staff. They don't have enough people that are quarantined, so they can't send, in many cases, people from one department to another because they need to isolate them in order not to spread the virus and so on. So regardless whether you were a big nursing homes or a small nursing home, now everyone understands that they need technology. And maybe for the first time, they will see like real financial incentives for them through that, government and federal support, and in order to go there, to make that jump that they need. Because healthcare, we all know that that's probably the most conservative industry in the US. I worked in different industries. I've built a business in utilities towards energy companies, smart grid billing and CRM, and I've built a kind of a cloud-based point of sale to retailers. So the industries are always, they are moving slow, but there is no industry that is slower or more risk averse than healthcare.
Yeah. Completely.
But now, and everyone we're talking, as you know, for the last decade, about that healthcare will go through transformation as well, like all these other industries before. And now, healthcare will get into a transformation phase, probably in the next 2 years. I think that we will see financial trends in terms of technology and IT in healthcare that we haven't seen for the last decade.
I completely agree. And, I keep saying this, for as absolutely terrible and heart-wrenching as COVID-19 is, we can have some positive view of the silver linings, right? Because we got to have some hope somewhere. And the silver linings is, I think that this pandemic is changing the mindset, increase, like you said, increasing the necessity and the need for digital tech and healthcare. So my background is in marketing, and a big part of what I've done historically over the last couple of years is helping brands create awareness and create demand
Right.
for their solution. And I mean, right, what I hear you describing is that there is more awareness than we have ever had, and there's more demand, and it's kind of happened overnight. And so what we might have had to do for years, trying to persuade people that you have a solution to a problem that's really important, but not really important for them, or not the priority right now. And a lot of that has shifted. So I think that's great. One of the things that I think of is that, so, companies usually are successful to a great degree based upon their ability to create that awareness and demand for their solution. And so now, as the overall awareness and demand, like across the country, I think that it changes the competitive landscape, right? So it doesn't just create opportunity for you, but it creates opportunity for every telehealth remote monitoring company. So, what are some strategies or tactics that you're thinking of, or that you have in place over the next couple of months, to make sure that when elderly care facilities, when hospital systems are thinking about, like, okay, we've got this new normal, I'm ready to invest in this, what are you doing to make sure that they're aware of your particular brand and that they think that you're the better solution compared to the competitors?
Right. That's obviously the $1 million question in terms of how you differentiate yourself and how you write basically what's coming after. So one thing is to be perfectly aligned and ready for the day after, in terms of having the product in place, making sure that we suggest now deployments that are done within 48 hours. So once you say that you are interested, we've built a new process in order to make sure that we can get to the site like within 48 hours and do kind of a scoping and activate the system for you, because it's all SaaS, right? It's all cloud-based. So all you need to do is get to a web interface, and then we give them the smart bands and that are doing the gesture detection and measuring all those physiological measurements, and that's it. So that's one thing.
Yeah.
The other thing is keep presence in the media, kind of in various channels, in order to explain our differentiation, because before the crisis, many, when you got to an elderly care facility, for example, or for a hospital, in most cases, they weren't looking for remote patient monitoring, unless, the few that we are working with and they were interested before, but most of them were not. And when we explained then about our competitive advantages, you don't need to do any hardware installations, beamers, sensors, base station. All you need to do is have like a wearable device on the hand of the individual, kind of, you can shower with it, you can, you can charge it only like once, every 4 to 6 days and so on. It works everywhere, indoors and outdoors. Because again, we are on the individual, we are not installed at home, you don't need to send a technician, and we have that proprietary gesture detection technology. It was all nice, but now we can translate it to, okay, so what does it mean to you? It means to you as the healthcare provider, 2 things. One, savings, because this will cost you 1 scale less than everything else that exists in the market. So if you want to deploy it fast, you will need to allocate less financial resources. And we all know that right after the crisis, they will be stretched for money. They all tell me like every week, oh, we've lost $20 million this quarter, and we spent like by April we already spent like almost our entire budget for the year and stuff like that. So they're all, you know, they will all be super stretched for money. That's one. And two, because of the fact that with our solution you don't need installation of technician or no maintenance, and it's all cloud-based, it means that it's much faster. So they can deploy and they can adopt their procedures, their medical procedures to it, to work with the system very quickly and be prepared for the next winter, right?
Mm-hmm.
We don't know yet if there will be vaccination until then. And in any case, we know that they will need something by then. So we do what we can in order to be ready, so that the minute we can get into the elderly care facilities the day after, we will. That's so, you know, it's mainly preparing the company and making sure that the product is ready, the marketing is ready, the finance is ready, everything. So you come kind of with a package. So, you know, in a way, it's a good time to organize your offering, package it in a way that is kind of ready to be served in a simpler way than it was before, because we were, you know, running and all over the board and traveling and, you know, the normal course of business in a startup.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
Yeah, so I think I hear you saying a couple of things that, you know, you as well as other health innovators maybe need to take a look at their positioning strategy, because how you're positioning your solution in the marketplace might change now that we've got this global awareness and global demand. The value proposition might need to be refined. Maybe not completely changed, right? You're still delivering the same value, but how you communicate that might need to be really different. So you're grabbing those, you know, those people's attention and kind of differentiating you right out of the gate. Again, as I think the competitive landscape is going to change exponentially. The other thing that I hear you saying is really pricing models. And I think that's interesting because I haven't talked a lot about that yet. You know, there's an increased awareness, there's an increased demand. We've got probably really much shorter sales cycles. So there's all these different positives, but then we're talking about prospects that don't have any money.
Well,
right?
And that's the difference between CapEx and OpEx. What I foresee is that the healthcare providers will be really short on CapEx, but they will be able to fund new systems and platforms with OpEx. So as you and that's and this gives, for example, companies like us an advantage, because unlike the you know, old times remote patient monitoring systems where you needed to invest large capex at the beginning for installation and stuff like that. With SaaS platforms, the shift is going from capex to opex. So it's definitely something that will ease the adoption for healthcare providers.
Yeah, so I think that's really important and very critical and in a huge advantage for you all.
Right, right.
Yeah.
But now let's, go back to reality, to the existing days, something that you've
So
mentioned.
let's just keep dreaming about that day after, what it's going to be like, rainbows and butterflies.
Yes, yes, I know, but still, running a company. Now, the problem is that, keeping the presence of the company in the market when you are, stretched with respect to your burn rate. And the first thing, that the easier thing to cut is marketing, right? Uh,
You broke my
because
heart.
yeah, but that's
No,
the
it
tough
happens all
reality.
the time.
That's the reality of startups in a crisis. You keep kind of the technical labor because you need to maintain the technical advantage that you have in the market. And you say, well, there is no market, right? So I need to freeze everything that is communication and Marcom and stuff like that, which is very difficult because it means that you are not positioning yourself, you are not investing in the positioning towards that market that is about to happen. And again, we come back to the same question of when is it going to end? Because if it's going to end only in 5 months, then you can, freeze marketing and get back to it, social media and everything, PR and stuff like that, kind of a month before, 2 months before. But if the market is going to be back in 2 months, you need to keep yourself on the radar, right? To keep the presence, to keep the news, for people to see the work that you do. We get calls from Japan, from Italy, from the UK, from Israel, from all over, from nursing homes and stuff like that, asking about. They've seen us in the media. They want to hear more about the product. They want to see a demo. They want to understand how much it will cost them and how long it will take them to deploy it. So we are having every week all these conversations because of we keep that level of awareness, but it's very difficult to maintain it while you don't know until when you need to keep your cash.
Yeah, absolutely. Or like you said, are we building the awareness, the marketing and the sales pipeline for 2 months, for 6 months, and and it's unpredictable. No one knows.
Right.
Yeah.
Exactly.
Mhm. So I think that is, it's it's very important consideration, because I think, I mean, I don't know if I would say that it really, like health innovation, you could kind of put it into two complete buckets, 50-50, but there are definitely those folks that, just have a tendency to like just crawl up in a blanket and go, we need to stop everything. I don't know that that's going to be a successful business strategy going forward, right? And then there
No,
are,
we haven't done that. And luckily for me, we have the support of the board, which is very important now for
huge.
CEOs. This
Yeah.
is critical to avoid kind of shutting down the company,
Yeah.
to
Yeah.
keep the company at a high level of readiness. Again, obviously, we were proactive and we did whatever cost reductions we could. But we don't think, and again, I'm lucky in that perspective, we don't think that hibernation would be the best
Sure.
strategy now.
Yeah.
Again, it might be different if we were in a different business, but given the nature of our customers and what is expected to be their needs right after the crisis, what we really need to do is to be prepared.
Yeah. And, because at some point, like you said, whether it's a flip of the switch or whether it's a slower turn of the dial,
Right.
change is going to happen. And who are they going to remember?
Right.
Right. And so I am seeing a lot of really incredible success stories. I like to say that right now is such an incredibly proud moment for marketing. I am enjoying the COVID commercials and social media content more than the Super Bowl. I'm like, I mean, like we're just, I mean, it's
All right.
so heartfelt and compassionate and authentic and real and human. And so there's just so much. I mean, I think that there's a huge opportunity to build relationships through digital channels. And it's not necessarily about selling stuff. It's just about building relationships and strengthening that trust. So that way, when we do flip the switch, turn the dial, and I'm like, okay, now is go time, then I'm thinking of your brand and not the other, 50 competitors now.
Right.
And so I think that that's going to be a game changer. I think that's going to be a, what do they call it? A sifting of the wheat, if you will, that, those companies that can financially afford to stay the course, and they aren't just part of the noise. They've got a very powerful strategy for rising above the noise, and they're not just selling their wares, because that's offensive right now in a lot of ways. But they're the ones that are going to win. They're the ones that are going to come out ahead of this at the end.
That's true. We should remember also that probably we'll see a difference also with the customers, because what we believe will happen is that there will be a consolidation in the industry, because their expense structure is going to change. They will need to invest much more in technology than they used to do before. And they will need to have, let's call it a critical mass, a minimum critical mass of staff in order to maintain quality of service. And in any case, given the process that already started with the regulation of measuring these elderly care facilities and rating them and giving them business or funding reimbursement by their level, not just by the number of beds, what we'll see is probably consolidation, M&As, and largest group being created, which means that there will be fewer customers to sell to, even though it's a huge market, right? There will be fewer number of customers to sell to, but the customers will be larger in terms of number of beds and number of patients and stuff like that, which makes it an easier sell, because typically in healthcare, there is the economy of scale. So there is, in order to get to some return on investment on new systems, you need to have a certain scale, because then the numbers kind of run for you. So this will make the work of the companies that will exist in the market a little bit easier, because every customer will be more dominant in terms of the numbers and the revenues and so on. And with what you've mentioned before, the probable shorter cycles for sale, that's another, that's something that should help with respect of the missing months in business, because we are probably going to lose between 3 to 6 months of business, if we start counting from March. And in order to, keep our financials, we need to catch up after when the business will go back to the new normal. So it's going to be interesting. Like it's going to be a new market. There is no doubt.
So I think that it's really smart. And what I hear you saying to our listeners is, for every person, it's really important to scan their market, right? The market conditions are changing. They're changing in different ways for different health innovators, but everyone needs to pause and take time to scan the market and kind of anticipate what it's going to be like, to the best of our ability, of what it's going to be like on the other side of this, and then recalibrating or pivoting their market strategy and other strategies around this new normal or this new market. Because, I think I think that there's going to be hardly a case where our pre-COVID market strategy is going to be a successful strategy going forward.
Right.
We're going to have something new.
Correct.
Mm-hmm.
Correct.
Yeah.
It's
Sounds like you guys have made a lot of progress, have done a lot of work in exploring that and analyzing that to make sure that you're set up for success.
Yeah, we hope so. We are trying to do what we can. You know, we don't have a crystal ball, and so we are, you know, preparing the best to the best of our knowledge, and we are confirming it with our investors and with our customers. In order, you know, we make sure that they are happy with the system, and you know, we get. One of the important things that we do now with the customers that are using now our product is getting their feedback on how they use the system with quarantined residents and with isolated patients. And with that feedback, we created, for example, a new marketing collateral that is focused on the relevancy of our system to COVID-19, to health providers that are, you know, fighting with COVID-19, that are, you know, in that challenge. So it's different from normal days, because prior to that, we were in a different world. And now, because of COVID-19, we switched kind of the questions that we ask in terms of attending to needs that are different than what they used to be before, because it's not the same clinical measures, it's not the same processes that they attend to people, because again, the facilities are in lockdown and residents are quarantined or isolated and stuff like that. So even the product is changing. It's not just how you position the product, but you change the communication layer in order to make sure that you will have a two-way communication with the patient, right? You add questionnaires in order to see, to try and monitor subtle changes that you haven't noticed. You look at other parameters through other devices or data that they capture in the electronic health records. So you deepen your integration with electronic health records in order, again, to see those changes that relate to quarantined patients. So you do all changes across marketing, across finance, across product. It's not just, you know, everything is normal like we used to run before. You change every aspect of the company trying to prepare.
Well, and I think what you just said is brilliant. So I talk a lot about, you know, over the last couple of years about co-creation with customers, right? And how incredibly important that is, because you know, when you're getting their feedback at all 5 codes that I call it, you know, all the way from ideation all the way to launch, not just the actual like, hey, I built something, you like it? Yeah, you like it, right? Like just looking for them to confirm what you already built, like, yeah, give you the thumbs up. And you know, it sounds like that is just as critical today as it was previously, and that, you know, before we couldn't assume that we understood their needs and all the little intricacies of the features and functionality that were going to be the most impactful to them. And it sounds like your guys, you know, you're taking that approach as well, even now in the midst of this crisis, that we still, you know, as the company, you know, we can't act like we're the experts. Our target market is the expert, and let's just ask them and kind of, you know, make them part of that product development process, even during this COVID crisis, to make sure that whatever you have is going to meet their needs when you're flipping this.
Right. That's something that, in fact, we learned early on, because we were we participated in 2 healthcare accelerators in the US when we started the company in order to do the product market fit. First, we've been to Dream It Health in Philly for 6 months, and then attended the New York Digital Health Accelerator for another 6 months. So that was very helpful in the early stages of assessing the product market fit and the value propositions across the healthcare 4Ps, right? The patient, the physician, the provider, and the payer. And now, meaning and then you get to kind of a state of mind that you get all the time feedback from the customers, and you change the product accordingly. And even now, while we are, in March and April, half of our technical workforce are working on those changes that came from those facilities, those elderly care facilities that are dealing with COVID-19. They are building new insights. They are deepening the integration to other systems that are monitoring the patients, that are changing the UI of the apps and of the dashboard in order to reflect the parameters that the medical teams perceive as more important now and stuff like that. That's how important it is.
Mm-hmm.
So you don't stay and say, okay, well, that's my product, and I need you, the customer, to learn how to use it in the new scenario, in the new environment. You say the opposite. You say, okay, what is it that you need? We are going to change it to you, and we are going to change it to you within a month, so that this month still you will be able to enjoy the new build of the software that contains all those things that you said that will be helpful for you. And guess what? This builds loyalty. Because they see we respond, that they see that we are attentive. We don't just disappear and wait for them to come back. So this is, how we are trying to help our customers.
Well, that is such a powerful example, because I just lived that as well. I'm not developing technology like a lot of our guests on the show, but we're developing processes and knowledge products for innovators like you to be able to help them develop their strategy and make sure that it's going to be the most viable, the most profitable strategy for that particular company. And previously, we developed what we called COIQ. It was all about early adoption and really being able to educate and inform and help people build that specific strategy. And it was so apparent to me the second week of March that the conversations that I was having on this show completely changed. We were not having conversations about early adoption strategy. It was all about pivot.
Right.
And so our team the last few weeks busted their butts, like your tech team, right? Probably working day and night 24/7 to do their adaptations, and created this pivot kit because the market's needs have changed. And I would be a fool to ignore that and continue trying to sell the old thing when the market's different, completely different. Right. Yeah. And, I don't know that we'll ever sell that old thing again. Right.
Probably not.
Right. Because I don't know that and if I was banking on, well, let's just get through this, and then, 3 months, then they'll be ready to buy the old thing. Probably not. Like it's probably just going to be different for now on.
Yeah, our market completely changed. I expect that the next 2 years will be around selling IT systems that could help in a period of epidemics.
Yeah.
That's I believe that it will even get to a kind of a regulation guidelines of the system that every healthcare provider needs to have in order to cope with such. Such a thing did not exist before. And now it will probably be kind of a mandatory tool in their toolkit. And, we will adopt our product portfolio for that messaging as well.
Yep, completely. And I love what you're saying, because it sounds like you're saying that, like, it's just part of who you are as a company to stay close to the customer, because the adaptations that you're making to the product technically right now, you still don't know how long that's going to have a shelf life. right? So like we may be pivoting 6 or 8 times over the next 6 months or the next year, right? It's kind of like, okay, well, that worked for a couple of months, but now regulation stepped in and their needs, the demands are changed again. And so it's, you know, it's just part of business, right? We just continue to keep our ear peered or open to the market, stay close to our customers, and continue to meet their needs on an ongoing basis.
Absolutely. The one thing that I've learned in the last 2 decades of building an enterprise grade business is that you need to be super attentive to the customer. You need to listen, not come in with the approach of, I built this wonderful thing and I'm going to educate you, the customer, how to use it.
You're an idiot. Something's wrong with you. right.
Yes, like, exactly.
No, wrong approach.
Right. So that's basically you, and it's really at the DNA of the company, right? To be a listening organization. We do what we do not because we build product for the shelf, but we listen to the customer and we build the product according to that. So because they are the healthcare experts, not us.
Well, thank you so much for all this incredible wisdom that you shared with our listeners today. I think that there are so many golden nuggets that folks are going to find in listening to this show. So thank you so much for your time.
Thank you, Dr. Roxy.
As we wrap up, how can folks get a hold of you if somebody is interested in your solutions, or if they just want to, you know, kind of bounce ideas off of you as we're all trying to navigate this new market together?
So first of all, they could go to our website, www.somatics.com, and there is an info form there. They can send an email to info@somatics.com. And they can also send an email to me directly, Erano, ERANO, @somatics.com. And, you know, we always try to respond within 48 hours and provide the material and get into a Zoom session and so on. It's easy, very easy to find us. We are based in New York, Eastern Time, and we are here.
Well, thank you so much, and be safe and be well.
Thank you. You as well. Stay safe.
Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.